This is something which most women don't hear from their gynecologist. All of us talk about pregnancy-induced diabetes or gestational diabetes mellitus in pregnancy, GDM in pregnancy. And most women are completely scared of the fact that having sugar in pregnancy can lead to complications like having a big baby, having a lot of fluid, eventually landing up in a cesarean or shoulder dystocia, so on and so forth. But what most women don't hear from the gynecologist is this. So when you are a diabetic in pregnancy, when your body is just loaded with sugars, the baby is also exposed to a lot of sugars in the womb. So when the baby is exposed to such high sugar content in the womb or in the amniotic fluid, it automatically goes into a state of reprogramming where it modifies certain genetics mechanisms in the way they metabolize sugars, in the way the baby metabolizes sugars. So when this baby births, it has a tendency to go into a hypoglycemic state because it's suddenly deprived of all the excess sugar when it comes to the outside environment, when it just births, right? So this is something most of us don't talk about, that is hypoglycemia immediately after birth. The baby tends to remain hypoglycemic, or the baby tends to have episodes of low sugar in the body, which needs to be treated as early as possible. The other thing which women don't hear from the gynecologist is the fact that the baby remains at risk of developing diabetes later in the adult life. So this metabolic reprogramming which happens inside the mother's womb, leading to the baby to make some critical changes in the genetics, makes the baby susceptible to being a diabetic when they are around 35 or 40 years of age. So if you don't want to give that risk to your baby, always make sure you attend a preconception checkup, get your sugars checked, get your profile checked, and if you're a diabetic, have a good control of sugars, and then embark on this pregnancy journey. For more information and updates, subscribe to my YouTube channel.